Hey guys, so it is Thursday, day 1 million and jillion and 3 of quarantine. My video today is going to be a little bit different. So I don't know if I mentioned in my other videos, I got in a really bad car accident about 2 years ago, resulting in a full knee replacement on my left knee. Did that last summer, had my knee replacement. And then therapy went great. I was back to work by the fall because I had it in June. So September of this year, I was back to work. I could never run yet. Couldn't go on my bike yet. Walked with a very, very slight limp. But other than that, everything was great. Week before Christmas, I fell in my son's room. And we have hardwood floors, and I went right down on my knee. And anyone that's had a knee replacement, the number one fear and rule, do not fall on that knee for the first year. You are in like the danger zone. So I fell, and immediately pain like I have never felt in my life. I mean, I wish I would have a total knee replacement over compared to the pain I felt that millisecond that I fell right on it. But apparently when I fell, my kind of went like that, where my foot kind of like went like, you bent your knee, and my legs swelled up instantly. I actually went to work that day. I did a lot of this icing and sitting as much as I could, but the next day I took off and I went and seen my the surgeon who did the knee. Right away we took images, and it looked like the equipment inside, like all the metal was all still intact, looked great. But I couldn't straighten or bend my leg to a certain extent. So we waited a little while, tried physical therapy, but I was losing feeling in my upper quad. We did ultrasound. He was almost guaranteeing that I probably tore some type of ligament that went from my quad to my kneecap. Nope. The ultrasound turned out great. So I had a EMG, which is a nerve test. The nerve test revealed that I have very, very little nerve happenings in my quad. So in a nutshell, my quad on my left leg is starting to die. The muscle is dying. It's not in use. The only way I'm walking and my leg is getting from like back and forth, it's like a swinging pendulum from my hip to my foot. That is what's pretty much controlling my leg. I did fall again on the knee because my leg gave out because of the weakness in my quad. So now I have to go to Philadelphia and meet with a neurosurgeon who is going to find the nerve that is actually either damaged or torn and fix it. Because of the the shutdown for the COVID-19, I did have a video call with him, and he looked at my leg and he said he can definitely see, just even over the phone, how dramatic different my leg looks compared to the other. I cannot lift it far off the floor. Like if I'm in sitting position, I'm going to even show you guys in a minute how much little range of motion I have, but then I'm going to show you what also I have in store for you. So I cannot straighten my leg totally, and I'm going to show you in a minute. When my husband comes in, he's going to kind of take over the phone, and I'm going to do all my talking. I cannot put my leg to a straight level. So I have a custom-made apparatus that is going to hopefully start straightening my leg, get my muscles to relax, straighten, and stay that way. It just came in yesterday. The guy slapped this sucker on me. It's almost going to be like the same concept as braces. I have to do this 3 times a day for a half hour. And I will show you how I do all the cranking. And you're not going to see a big thing, but I'm sure you're going to be feeling it. And within time, hopefully this will work the same way braces does. It doesn't look like they're doing anything, but within a few months you see it totally different in your teeth. So I'm hoping to see a little difference in my leg. So I'm going to show you guys my mobility of my leg so you can see what kind of predicament I'm in. So when I do have the surgery for my knee, or not for my knee, for my quad, with the neurosurgeon, you're going to go with me on my journey. You'll know where I kind of started at. So my husband's going to take over. We're connected to a cord here because my phone's going to die. So, let me just clean my phone here. Sorry. Oh, made it worse. Okay. So, if you want to go out so you can see, you can unplug it for a minute. It's not going to die. You can unplug it for a minute. So, you're going to see, I'm going to show you my good leg to my bad leg. Ignore all this. It's motherhood. So this is my good leg. Go straight up. I could bend it. I could do anything that anyone could do with their leg. This one, I want to go down on my camera. There you go. This one. Okay, so it's my good leg. Go down a little more. And that's as far as I can get it. And I was trying to kick it out like that. As far as going up, I can only go up that far. This one I could go up this way. So usually I'm always picking my leg up. And yeah, so we're gonna go up on the bed. So this is the device that you wanna come over here. You should like follow me. And okay, we're gonna need to plug you guys back in. I decided to do this. Here's my heating pad that I put on my knee every single night. Let's get you guys plugged in. This is the behind the scenes of me. So I don't know what this is called. I know there's like a crazy name for it. I'm going to call it my Forrest Gump apparatus. So this was custom made. They measured my leg. They measured every inch of my wherever this thing's going. It's custom fit for me. So it took a little while to come in. So this is the first time I'm actually putting it on myself. So here we go. Okay, out. Wait. Okay. The guy made it look really easy, and he did it super fast. Watch how frustrated I get at this thing. Okay. So, okay, why is that not doing that? All right. So all I remember him saying, he was talking like a mile a minute. Probably wanted to get out of because he came to my house. So he probably wanted to get out before he thought he was going to get the coronavirus. I'm supposed to be going to physical therapy twice a week, but I have not because I do not want to be around people right now because of the virus. All right, that felt snug.
Suck if I sneezed on you.
Huh?
So it would suck if I sneezed on you. Joking around about the virus.
Okay. Yeah, this guy, like, I mean, this thing goes all the way up to my thigh. He was all up in my space. But he was very professional. And maybe that's why he was talking so fast. To get up and out of here. So, just kind of buckling myself in here. I have to sit like this for a half hour. 3 times a day. It even came with like a carrier thing in case, like, say I were to go like out of town or something. I have to do this for, I think they want me to do this for like 2 to 3 months. And look at that. Right there. Made in the USA. So, I'm in. This thing has to be kind of, God, my leg is so damn small. Oh. So right now, it's actually, I don't know. So I gotta start cranking it. And what it's going to do, it's going to start straightening my leg out little by little. So I'm going to crank it toward me, which is technically almost compressing my leg down to go straight. Once I feel the slight pull of it, that's when I stop. Because you want to feel a little bit of strain, he said, and every maybe 5-10 minutes within my half hour, once I feel my legs relax, I don't feel that strain anymore, I'm going to tighten it more. I can feel it moving. I'm waiting until I kind of am going to feel it back here on my leg, on my knee. And this thing goes. I mean, these things got spring loads. At first when I did it yesterday, I'm like, oh yeah, I feel it. And like that doesn't hurt. And yeah, it started hurting like after like 2 minutes. So pretty much what this is doing is pushing my knee down to the bed. If I do it with a chair, I could do it like that, which he kind of recommends. But just for showing you guys right now and comfortable in my bed. So I gotta do this every, we're gonna have to, like, morning, noon, and night. I gotta do this. So I figure this is, like, you know, the best thing. You can be back. Thank you. So I'm gonna, can't flip it around. But yeah, this is the whole contraption. It doesn't hurt, but it does feel like pressure. Because, yeah, I can feel it hurting now. So, we're in a good place. He said it shouldn't hurt dramatically. If it does, that means I went a little crazy as far as putting these things are like spring loaded. So, there's a lot of pressure going, even though it doesn't look it. Obviously, I can't walk when I have this thing on. So, this is going to be a game changer. So whatever the condition is that I have for when I fell, my doctor told me he's only seen this happen one other time, but that was because I guess there was surgery he had done on somebody's leg, and it was a result of something that went wrong during surgery. He said that is not the case with me because we would have obviously known that right off the get-go. It was from that fall. So I limp a lot. Everybody, and my knee swells up dramatically at the end of every day, especially if I'm walking. So the corona thing, it's kind of like helped me chill out with the walking. But if I'm up and down a lot, the last few days I have been, my knee it looks so distorted. Sometimes I still fear that there's something wrong within the knee and the components of the equipment, but we have done so many x-rays hoping that the swelling went down. I took medication, like really high anti-inflammatories, took images, x-rays, ultrasound. He has not done an MRI because there is so much metal in there. He's not going to see what he really wants to see. So he does not believe that there's anything wrong with it. My gut tells me different, but I'm just going with the flow. So he did do the nerve test, and it did show that, yeah. And I had said to him, you know, what happens if I ignore this and just deal like this is what my knee is going to be in my leg. It's more of my leg at this point. And he said in some point, you know, he wouldn't want to have to see like an amputation, but I would have to become septic for that. But I am susceptible to falls, which I fell directly on it one other time, and then I fell backwards 2 times because I felt myself falling, and I just put all my body weight backwards, and I didn't care what I was going to hit, just as long as it wasn't my knee again. I have to use a cane. I use it in the morning when I feel like I'm unstable, because, you know, you're just waking up, but I should be using it all the time. Now, even after the neurosurgeon and the surgery goes for that, if I get my legs straight, if this contraption that I'm wearing right now works, and I get my legs straight enough that the surgeon here that did my knee is happy, I will then get like a prosthetic quad. They'll custom make that, and that'll be something I have to wear permanently until the nerve heals. So that'll be interesting. He said that, I know, you know, as a female, you don't want to wear it because it's, you know, it's going to feel bulky and this and that, but it'll keep me from falling. That's going to be, you know, the thing that stops that pendulum I was talking about. So, oh my God, this thing is like, it hurts a little bit. It's actually feeling like really achy. It feels like somebody's like pushing down on my leg and just like, we could let go now, but I can't let it go. the pain I'm feeling in a little bit, if that pain goes away, let's say in about 15 minutes, I take this knob right here and I'm going to crank it toward me, even by a hair, just to make my leg kind of like wake up, like, hey, you're relaxed enough. Let's stretch out some more. But the guy that came, he said he actually had one of these, I think for his ankle or something. It was the same concept, and he said it worked. And he looked like he walked fine to me. So I am praying that this works. I am praying that the nerve surgery goes well. They don't know until they get in there. As far as once they go in there, will they have to just kind of re-zap that nerve, kind of wake it up? Or do they have to do a nerve graft? Don't know how that goes. But I won't know until I wake up. That'll be a while. He said I'll be put on a waiting list because of the coronavirus. But he does want me to go there for specialized testing that people are trained for this type of thing. People out here in Lancaster, it's not a very common thing. So my doctor pointed me to the best, and there was no better place than Philly Hospital, and I put my trust in them. So I wanted you guys just to kind of get a glimpse of the behind the scenes of me. I'm not all about makeup all the time, and yeah, that's that. I do come with a bag full of health problems sometimes. I think I've told you, you guys kind of were on my journey with my endometriosis. I did make a video about that. Now, my gallbladder's acting like a jerk. So, tomorrow I have a phone conference with a surgeon. Another one. They're going to, there's a bowel duct that is open and it's causing me a lot of pain when I eat, so I don't eat a whole lot. I have to eat a lot of like bland stuff. So I did a MRI the other day. It confirmed. So now they have to go in and take that bowel duct out and put a stent in, and that's going to happen sooner than later. So in a few weeks, I'm going to be going for surgery for that. You guys are going to come on my journey with me, which that shouldn't be too bad. That should be like a piece of cake compared to what my leg has gone through. So, but anyway, all right. Thanks guys for watching. I hope this helps anybody, because I went on YouTube and found nothing that I could find as far as my situation goes. I mean, when I went for my total knee replacement, I was watching all kinds of YouTube videos, people's progression, did it hurt, you know, this and that. If I had to have a knee replacement again, I would totally do it. It sucks. It knocks you off your feet, but it actually didn't hurt as bad as I thought it was going to. So that's that. All right. So I will talk to you guys later, and thanks for watching, and be safe out there. All right. Bye.